All right, and we are live on YouTube as well. Excellent. Just want to make sure you guys see me okay. Let me know on YouTube if you guys can see me here. I think yep, you can see me. Perfect. All right, awesome. All right, we are live. Let's dive in. Instagram people say audio's coming in great. Excellent. So I did a video this morning on YouTube that came out. We talked about nebulizing glutathione. I see a lot of patients that have mold issues, a lot of mold toxicity, environmental mold, whether in their home from high humidity levels or water damage. Liposomal glutathione is a really great option, especially if you can nebulize it. I did a video this morning on YouTube. We'll try to put it below, youtube.com/JustinHealth. Take a look at it. But I go through the steps on how you nebulize glutathione. You use a special kind of glutathione that's water soluble. Typically, it's mixed with a sodium bicarbonate, and you use a saline solution. And then you can put it in like a portable nebulizer like this, and you turn it on, and then you can get fresh glutathione via nebulizer. Now, the benefit of nebulizing glutathione is it can get right into your lungs at a much higher level. Now, if you're doing like oral glutathione, that's good, or liposomal is great. The problem is it may not get to the area in the lungs. So if you have like mold issues or you have a lung infection, you can get it right there directly, and it increases the intercellular levels of glutathione a lot higher. So you can see it's actually pretty quiet. Like the old school nebulizers are really loud, so this is nice. You can do it next to your partner while you're sitting on the couch watching Netflix or something, so pretty cool. Great way to get glutathione into the lungs at a much, much higher level. You can also do it with colloidal silver too. Silver is going to be more for like dealing with an infection. You need to make sure you get a high quality silver. You're doing some kind of a silver that's like a 10 part per million or so or less. That way it's small enough so it's not going to get stuck in your lungs. There's not a lot of research on that, but a lot of good anecdotal evidence out there on it. And again, when you're trying to get to that area specifically, it's really, really helpful. So hopefully you guys appreciate that. All right, so live Q&A here. What do you guys want to chat about here today? I got a video coming out tomorrow on ketogenic diets and insulin resistance. We kind of break down some of the science on that. We did the nebulized glutathione video here this morning, so take a look at that as well. What's on the list? What do you guys want to chat about? I'm going to jump over to YouTube, see if there's anything on the queue. Okay, so big things clinically, what I'm seeing in the office this week is a lot of people with very bad food allergens, like, extreme food sensitivity. I'm seeing more patients that I'm making a recommendation for a carnivore diet to. And a carnivore diet can be really helpful because people that have extreme food sensitivities, a lot of times they're sensitive to a lot of the anti-nutrients that may be in plants, some of the phenols, some of the salicylates, some of the phytates or oxalates, and you can see these in some of the plants. And for people that are like more autoimmune sensitive, they can really have a hard time with it. So I'm seeing a lot of people that are like more on that autoimmune, irritable bowel kind of level or very sensitive, doing pretty good on a carnivore template. And the carnivore template for me is not something that maybe should be done for life. For some people it may be, because we do it for a period of time, we get some results, we plateau. We do a provocation, so we eliminate, and then we add back in, means we provocate. And if we have some negative reactions, that tells us we may want to think twice about adding things back in. But when we add things back in, we're going to add it back in one at a time. So we'll go one food every 2 to 3 days, smaller amount on day 1, little more on day 2, little more on day 3. And if we can add things back in, great. If we can't, then so be it. And when we add things back on the carnivore diet, I tend to recommend foods that are going to be lower, like SCD approved, meaning like lower salicylate, lower phenol, as well as lower FODMAP. And so we kind of add back in that ratio just because of the fact those foods are going to be less inflammatory in general. All right, a couple of questions in here. Are there more general health benefits for nebulized glutathione? Would it be better before or after heavy drinking? Yeah, I mean, you could definitely do it afterwards. You're going to increase your blood levels pretty fast. It's going to be better when there's a specific lung issue, for sure. In general, if there's no specific lung issue, you can do a liposomal form, which is great too. Hope it helps. Matt Whitewright saying, hey, Matt, hope you're doing well. It's been a while. I've been trying to keep new foods like organic sunflower seeds and hemp seeds. I've been using 5 tablespoons per day. Is there any issue with possible estrogens? Or it's hard to say. I mean, I think with hemp seeds like that, with good quality seeds, you're probably okay. As long as you can tolerate it and digest it, I don't see any problem with that, Matt. Really like the idea. How would this compare to a salt inhaler? Well, you're mixing it with a saline solution. It's a saline solution that's specific for the nebulizer. So, of course, the saline is going to have some kind of minerals in there. So it's going to mix in with that type of saline mineral support. So, yeah, you want to take that in a combination with it because you don't want, when you inhale it, to be really irritating on the mucous membranes in the nose. Very cool. What do you suggest for dry eyes? Well, it depends. What's causing the eyes to be dry? So I always look at the history. Omega-3s are very important. So I always try to increase cod liver oil or omega-3s when I see dry eyes. That's really helpful on providing hydration to the eyes. Also making sure the diet's anti-inflammatory, nutrient-dense, low toxin. Again, inflammation in the food would be the first, thing that I would suspect. Outside of providing extra vitamin A, extra nutrition, I mean, you can always do kind of a saline solution in the eye as a short-term kind of palliative. Samuelson's makes a nice homeopathic. That way you have a little bit of palliative support while you work on fixing everything in the meantime. Sonia writes in, I ventured into carnivore meals, just animal protein, intermittent fasting, 16/8, no dairy, and yes, pasture eggs. Good, that's awesome. I was a little concerned since originally I bought these for my wife to do seed cycling with. Yeah, I mean, seed cycling can be helpful with modulating some of the estrogens and progesterones and also binding up some of them as well. Dealing with the big complex problem of histamine, food sensitivity, itchy eyes, nose, itchiness. Is there a quick way to start to heal histamine intolerance from candida overgrowth? Well, the first thing is I always go to the 6 R's, right? So we're going to remove the bad foods. That's going to be important. And for some people, that may just be starting a paleo template. Some may be going autoimmune. We may have to add an autoimmune and low histamine component with it. We're going to be working on better digesting as well because foods not broken down properly can create a histamine response. And then, of course, getting rid of the infection. So if there is candida, great. We're going to get rid of it. We're also going to get rid of SIBO or any other infections. And typically, if there's a lot of stress or inflammation or mood issues, we want to work on the adrenals and hormone stuff as well. What are your thoughts on Ezekiel sprouted grains? Shows that it contains organic gluten, organic sprouts. Seems like a gray area. Yeah, I mean, it still has gluten in it. So, and some data shows that when it's sprouted, the gluten, let's say, absorption is going to be a lot higher as well. Okay, very good. Matt writes in, I'm literally always bloated. I don't eat, I'm bloated. I fast, I'm bloated. I eat AIP, low FODMAP, I'm still bloated. Along with being bloating, I also have stabbing pains in my abdomen. So got to start with the diet. Got to see where that is compared to baseline. Some people may feel bloated, but relative to eating a standard American diet or something else, they feel better. So it's all about relative. When you make that dietary change, how much better do you feel? Number one. Number two, got to get the digestive support kind of lined up in there. Number two. And then number three, got to look at maybe dialing in deeper infection land, right? There could be other infections kind of playing a role. So you got to look at all those together and you have to compare, relatively speaking, where you're at. And then from there, there's other steps, but we have to wrap our arms around those before we go a little bit deeper. Hope that helps. All right, any other questions, y'all? Feel free to let me know. So in general, a carnivore template can be very helpful as a good starting point just because you're cutting out a lot of those plant-based irritants. But then after that, you want to start adding those things back in. You want to do kind of a very methodical reintroduction, adding some of those plant foods back in. SED, low FODMAP, low salicylate foods is a good starting point. Matt writes in, you recommend some air purifiers before. I ended up getting 2 HEPA air purifiers, which seem to boost air quality. How often do you run yours? All the time. So I have an Austin Air right over here in the corner. It's a big one. It covers about 2,500 square feet. And it's got 30 pounds of activated charcoal and zeolite, so it filters a lot. The filter lasts 5 years. That's the nice thing about it. And it's pretty quiet and it's not a lot of lights. I'll also do the Air Doctor. It's a nice one. I have that in one of my rooms. And then I have a molecule which I like, but there's lights on the molecule. It uses some PET technology, photoelectronic technology to kill mold and viruses and stuff. So we keep that in the family room because there's lights on it, so we don't want it in the bedrooms. So yeah, if you want to access those, justinhealth.com/air, or go to the website and go to the justinhealth.com/shop and click on recommended products and you'll see it there. But yep, everything I recommend, I actually try and approve. Let's see here. What are the 6 R's you mentioned on removal? Not sure where to get started considering everything seems to cause a reaction. Would the GI map get to the root faster? Yeah, so getting a good high quality GI map test would be helpful to figure out what kind of infections are going on. But 6 R's: remove the bad foods, replace enzymes, acids, repair gut lining and or hormones. That's important. Remove infections, repopulate, reinoculate good bacteria. 6, retest. Very important we kind of wrap our arms around that. Matt writes in Dr. J, I'm on TRT, I think it's testosterone support. Dialed in for the most part, estrogen may be a tad high. All thyroid hormones are in the upper third of the range, but TSH is 2.5, taking 30 milligrams of NP thyroid. Good. It just depends when you're testing it. If you're testing your thyroid in the morning and you're fully fasted and you have not had any thyroid support, it makes sense why your TSH may be a little bit on the lower side. I typically do retesting on thyroid 3 hours after taking it in the morning. That gives me a good window of kind of where I sit during the day. Couldn't do the meat, guessing histamine from the meat. Could be, yeah, but if you're doing a carnivore template and you have histamine issues, you just gotta make sure that everything's fresher. And I like using an Instapot because the Instapot really pre-cooks that food, makes it easier to digest. Okay, excellent. Cloud writes in, my hair is falling out easily. I get a lot of dandruff and skin peeling off my scalp and nose and behind the ears. What could be this related to? I know I have gut issues and candida already. Yeah, so definitely could be from the gut. It definitely could be from the candida. It could be from all those things. It could be from poor digestion, and it could also be from other underlying infections. Great question. Basic question regarding stress. Yesterday, our area was plagued with tornadoes, and I was incredibly stressed all day. I couldn't seem to come down from it for hours, even with a high dose of ashwagandha. And that's tough, that's an acute kind of stress. That's going to be a hard one. I mean, you could do EFT. Those things can be really helpful. That kind of tapping with the eye movement, the EMDR work can be super helpful. You could do magnesium. You could do CBD. You could do L-theanine, all at high doses to kind of calm down that nervous system response. Yeah, so in regards to the nebulizer, take a look at the video from this morning. The capsules are 200 milligrams, so you can easily do 200 milligrams at a time. That's not a problem. All right, excellent. What would you have recommended? Carbs seems to help with high stress response. Yeah, all the things I just mentioned. Can Lyme and co-infections be treated with herbs and sauna only? Well, if you have Lyme issues, you want to make sure, okay, it's Lyme, and then also, are there co-infections present? What are they? Because there are different herbal formulas that we can use to help with that. And again, the sauna is going to be a really good detoxification method as well. We may want to add in some additional binders on top of that to help soak up any of the dead biotoxin debris. Toki says, your channel should be a lot bigger. I think what you're doing is amazing and you could help so many people. Yeah, I appreciate that. Yep, the goal is to help a lot of people. So I appreciate it. Just keep on sharing. If you guys enjoy the information, please feel free to share it with your friends and family. Almighty writes in, can you treat Lyme after 5 months of treating mold toxicity? Home is intermediated and we are moving. So yeah, I always kind of have a foundation in how I deal with stuff because Lyme and mold are like the great mimickers. Like they can look like any symptom and there tends to be a long rabbit hole in dealing with those things. So I always deal with foundational things first: diet, lifestyle, body system 1, hormones, body system 2, gut, system 3, detox, nutrients, mitochondria. I only deal with mold acutely if we know it's in the home. So if we see that there's mold in the home and or we feel significantly better when we leave the home, then we'll deal with mold more acutely. But we always want to deal with the foundation stuff, system 1, system 2, ideally first. So it really just depends. We'll test the home for mold. We'll also test the individual person for mold in the urine, and we'll provoke it as well. That way we can kind of prioritize how much of an issue the mold is. A lot of times mold issues become less of an issue because when we work on the foundational stuff, symptoms get better and better, so it tells me it's less of a priority. But if it's not moving and we feel significantly better getting out of the home, then we have to readjust everything accordingly. So it really has to be individualized for the person. And when there's a strong suspicion of mold, we got to test the home as well as the person. So we want to do both. Hope that helps. If you know stomach acid is low, but apple cider vinegar and a version of HCl causes coughing, what can I take to help digest? So we would do a combination of HCl and enzymes. We do a combination of that. Got to fix the diet too. Is there anything else that you would recommend that helps with chronic acid reflux? you got to fix the root cause. If there's an infection or some kind of a SIBO or H. pylori, you got to fix that. Thanks. Appreciate the feedback on that. And I'm glad that you're sharing with your family. Thanks for the kind compliments. Do you like any specific brand of unscented laundry detergent? There's a couple that are out there. Puracy is good. I don't like the smell of it. Go, I think Baby Go is a really good one. There's some mainstream ones that are actually getting pretty good reviews. All makes an unscented free and clear. That's got great reviews on the eczema Facebook groups. And then 7th generation free and clear. So typically, mainstream, if you want to just go to Target, you can get free and clear all or free and clear 7th generation. And then online, you can get Puracy or you can get the Go Organics. Those are all really good. And then you can get the unscented, which are nice. Thanks so much. Love your podcast. It's been a huge blessing to me and my family. Awesome. Appreciate it. Keep on sharing. Would 1 cup of coffee a day be enough to cause seborrheic dermatitis to flare up my skin and above lip? Well, seborrheic dermatitis is typically going to be a fungal thing. So coffee is not going to really be a big fungal producer as long as it's good quality coffee. If you're on the fence, you can always cut it out for a few weeks. I'd recommend a really good cream to topically hit it with. You could do for like the hair, you can do like Maple Organics. You could do ART Naturals. You could do, I think it's ART Naturals. Yep, ART Naturals, Maple Organics. They make a really nice tea tree one. Some have a little coal tar in it. And then you could do the mother of all creams for the topical stuff. That works pretty good. Okay, here, lost my space. Where are you here? Was looking for an alternative to antihistamine while trying to get to the root of the problem. Yeah, so in my line, we use something called Allerclear, which is like a bromelain, stinging nettle, kind of quercetin type of histamine degranulator. That works great. Could also add in some kidney glandular tissue, which helps reduce histamine while you get to the root issue. Excellent, great questions. You recommend the native has changed the life of me and my wife. Awesome, glad you like it. We love it. Glad to see that they're sold at Target, but surprising it's not in places like Whole Foods. I know, I'm surprised it's not in Whole Foods. They're starting to sell it at Target. Yeah, my favorite one now is the aloe, and the coconut vanilla one for women is actually a pretty good neutral set. I like that one, but it's not quite as strong. At the end of the day, I'll have a slight odor, but this new one, it's aloe and I want to say spruce, but it's the aloe one. And then little tip on that, they have flavors for like native, scents, native OS, but type in native OS vintage scents. They have a whole vintage scent line that's like not on their site. It's like hidden. It's like ordering it in and out. You kind of have to know the secret words to get it, but look for the vintage native OS. I'm surprised it's not even anywhere. So native OS, type in vintage scents. This new aloe one, I think with spruce, is phenomenal. Absolutely love it. Extra fresh all day long. All right, question here on Instagram. Just came off SIBO treatment and no more symptoms, but got blood work done and shows low levels of ferritin and B12. Still in the norm, but almost under. How to absorb those better on keto? So it just depends, right? You have to make sure you're taking HCl and enzymes. Just looking at your name, I'm guessing you're female. So if that's the case, you also have to wrap your head around menstruation issues. So if there's some cycle issues and a lot of heavy bleeding, that has to be addressed. So there could be some estrogen dominance there. It could just take longer to get the iron up. So you'd want to be on all of those things supplementally. You'd want to fix HCl and enzymes, and you'd want to make sure that you're, calming down the gut inflammation, doing all that, because sometimes the gut can still be a little bit inflamed and you may not be absorbing things well. So there's a couple different things that have to be done. Make sure you're working with a good practitioner to help you. It can be a little bit tough when there's 4 or 5 things and you're not sure which way to attack it. It can be a little overwhelming. What kind of doctor are you? Are you a general practitioner? I'm a functional medicine doc. So functional medicine, my primary is DC, Dr. Chiropractic, but I've not practiced chiropractic directly, for 5, 6, 7 years in general, primarily just functional medicine full-time to patients all over the world. I see patients virtually from my home office. So feel free, if you guys want to reach out, justinhealth.com/schedule. You guys can feel free and reach out. And if you want an intro consult, one of my docs will reach out to you and chat with you. Okay, great. Other question. If allergic to quercetin and vitamin C, what to do? Would you recommend aloe? So you could do a kidney glandular. Kidney glandular could be helpful. Matt writes in, are there any concerns or signs that we still have seasonal allergies, usually only 1 month out of the year due to high pollen levels? Should it be a sign to work on deeper gut issues? It depends. So I would have a really good air filter in your home, number one. And I would be just doing a lot of nasal sinus flushing because, of course, the bigger issue is if you're sensitive to pollen and then you're breathing it in, then it's all sitting in your frontal cavity and not flushing down. You want to flush it out with a good saline solution, maybe some xylitol. 1 to 2 times a day. That's going to help a lot, and have a good air filter. What tests for Lyme and co-infections or diagnosis based on symptoms? I'm using Biocidin, LSF, and Cellcore Biosciences for BART and Borrelia, Plasana, and binders. Yeah, I use a lab called Medical Diagnostic Laboratories, MDL. They work good. Again, you got to look at history too. If there's a lot of history in and around other types of Lyme or co-infections, you'd probably want to treat anyway. I treat a lot of the gut issues first, and a lot of times there's overlap with the gut stuff and the Lyme. So you see a lot of great results just by getting the gut addressed first, even just by happenstance. So I always focus on the gut first. Unless there's some kind of acute Lyme exposure, I tend not to dive in right away. All right, guys, I think I hit all your major questions here. I'm going to jump on a couple of patient calls here. I'll record some more videos later on today. Let me know what you guys think. Put your notes in the comments. If you enjoy it, give me a thumbs up. Give me a share. Really appreciate it, y'all. Guys, have a phenomenal week, and I'll be back. Take care. Bye.